Thank you, Mr. Kennedy. Mr. Kennedy, I will begin. Each of us will have 5 minutes to ask you questions, and then at the conclusion of the hearing, if there are further questions, there will be an opportunity for those questions to be submitted to you, and I ask that you respond to them promptly. Mr. Kennedy, you have emphasized the importance of nutrition in preventing and managing chronic disease, improving health outcomes, and reducing health costs. I share your interest in the relationship between our diet and our well-being. And if confirmed, I look forward to partnering with you on those efforts. Would you share with the committee why you are passionate about the nutrition-oriented disease prevention and what you have learned?
Yes, Mr. Chairman. I had 11 brothers and sisters. I had dozens of first cousins. I was raised in a time where we did not have a chronic disease epidemic. When my uncle was president, 2% of American kids had chronic disease. Today, 66% have chronic disease. We spend zero on chronic disease during the Kennedy administration. Today, we spend $4.3 trillion a year. With 77% of our kids cannot qualify for military service. When I was a kid, the typical pediatrician would see one case of diabetes in his or her lifetime, 40 or 50-year career. Today, 1 out of every 3 kids who walks through her office door is diabetic or pre-diabetic. And the most recent data from NIH shows 38% of teens are diabetic or pre-diabetic. Autism rates have gone from 1 in 10,000 to 1 in 1,500, depending on what studies you look at. In my generation today, 70-year-old men, 1 in 34 in my kids' generation. We've seen this explosion of autoimmune disease, of allergic diseases. This is not just an economic issue. It's not just a national security issue. It is a spiritual issue, and it is a moral issue. We cannot live up to our role as an exemplary nation, as a moral authority around the world, when we're writing off an entire generation of kids.
Thank you very much. And if confirmed, how could we work together to integrate nutrition-based interventions into our healthcare programs like Medicaid and Medicare?
Well, there are many ways that we can do that. The federal funding of the SNAP program, for example, and of school lunch programs could be a driver for helping kids. We shouldn't be giving 60% of the kids in school processed food that is making them sick. We shouldn't be spending 10% of the SNAP program on sugared drinks. So we have a direct ability to change things there. We also, in Medicaid and Medicare, we need to focus more on outcome-based medicine, on putting people in charge of their own health care, of making them accountable for their own health care so they understand the relationship between eating and getting sick. Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease so that Americans understand it and make sure that Americans are aware. But I don't want to take food away from anybody. If you like a McDonald's cheeseburger, or a Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that. But you should know what the impacts are on your family and on your health.
Thank you.